Hello all, my name is Dr. Pawan Yadav. I'm a consultant pulmonologist at Aster RV Hospital, JP Nagar, Bangalore. So nowadays we are seeing a lot of patients with sleep disorders. So there have been plenty of reasons for this, but medically the most concerning and most prominent amongst them is called as obstructive sleep apnea. So sleep apnea is a condition wherein a person is seen to snore loudly during his sleep, and during the morning hours he always complains that I'm not feeling so fresh, I always feel so groggy, I'm not able to concentrate for long hours. And they also usually have other cognitive disorders, like they don't remember things very well, their behavioral issues starts coming up, and other medical issues may come up, like poorly controlled diabetes, poorly controlled hypertension, heart issues, brain issues, etc. So now the general understanding in our community is that if somebody is sleeping and snoring loudly, that means he is in a very deep sleep. But unfortunately, medically, the understanding is such that somebody is sleeping well, that means there should not be any audible sound. So if somebody is sleeping and snoring or producing any audible sounds, that means there is an obstruction along his breathing pathway. So what do I mean by that? When I try to breathe in, the air in the atmosphere, right, it goes through the nose or the mouth to my throat. From there, through a windpipe, it goes into my lungs. If there is any obstruction along this pathway, that leads to an audible sound or snoring in case of sleep apnea. So somebody is sleeping and snoring loudly, and also if they have associated daytime symptoms such as the symptoms I mentioned before, that means it's a medically significant issue which needs further evaluation. So how do we evaluate this condition? When a patient comes to us with such symptoms, so we take a detailed history to see if there is anything else which is contributing to this recent onset of snoring and daytime sleepiness. So such history would be, is there any recent weight gain? Is the patient suffering from a medical condition like hypothyroidism? Is the patient been put on, has the patient been put on with on some anxiety pills, sedative pills to make him sleepy, which can worsen underlying sleep apnea issues? Or is there any other reason for sleep disturbances, such as recent surgeries or shift changes at workplace, etc.? After that, we do a detailed clinical examination to see if there is any anatomical, physical obstruction to the breathing, such as there may be a deviated septum or a hypertrophy turbinate, or maybe enlarged tonsils or adenoids in kids, or any other lung issues associated. If there is no anatomical problem, then we go ahead with a sleep study. So in case if there is any anatomical problem, if it can be fixed, which can reverse the condition of snoring and apnea, sleep apneas, that has to be addressed first. But if there are no specific anatomical problems, we proceed with the sleep study. In sleep study, it is a overnight analysis, a detailed recording of your physiological parameters like your oxygen levels, the heart rate, the breathing patterns, the sleep stages. Our sleep goes through different stages. So all of these different parameters are recorded through the night, and the next day morning we have a detailed recording, analysis and reporting of this. That is called as a sleep study report. With this report, we will be able to understand certain things. First of all, do you have a sleep apnea or not? If you have a sleep apnea, what type of sleep apnea? There are different types of them. And how severe it is, mild, moderate or severe. And is it contributing to other problems like drop in the oxygen levels? If there is a drop in oxygen level, how significant is that drop? And is it affecting your heart and other parameters? So with this detailed analysis, we will be able to recommend certain things for you. If it is a mild problem, we recommend lifestyle changes like weight loss and sleeping in certain positions, which help in relieving your airway obstruction and also subsequent relieving of your sleep apnea. If it is a moderate to severe problem, then we recommend you other procedures. To the gold standard for this treatment, moderate to severe sleep apnea, is to wear a mask connected to a small device called as CPAP, or a continuous positive airway pressure. What it basically does, it pushes the normal air that we breathe in with a little bit of pressure, and which helps in opening up your collapsed airways, so the obstruction which is leading to all of these symptoms gets relieved immediately and the snoring goes away, and you will get adequate air into your lungs, which will help in reaching optimal oxygen level through the night. With this optimal oxygen level being achieved through the night, your body and your brain gets adequate rest and you wake up fresh. Now, when you wake up fresh, you have a lot of energy to run through the day, you can focus better on your work, you don't feel sleepy, groggy, etc. And also you can start with other lifestyle changes like dietary habits and also regular exercises to keep your weight in check, which will also help in reducing the severity of your sleep apnea. Obesity and extra deposition of fat around your neck is a very important contributing and also in certain conditions a reversible contributing factor for sleep apnea. Thank you.